patients' care would never be compromised. There will always be someone there to look after them, either a trainee nursing associate or a registered nurse. So that is why we complement each other. There's never going to be a gap in the care that we give to our patients.
They have a more holistic viewpoint from the patient, and I've seen that in action in endoscopy, where our TNA, her viewpoint has changed since she's done this course. She sees the patient in a much more holistic way rather than just doing tasks for them.
So within endoscopy, our TNA was admitting a patient, and she noticed from the referral letter that the patient took recreational drugs. She felt empowered to ask the question to the patient whether this patient actually did take recreational drugs. She felt confident to do that. The patient then confided in her that they'd taken recreational drugs that morning, and the patient was asking for sedation. The TNA then, within her role, went and spoke to the endoscopist, said that the patient couldn't possibly have sedation, that wouldn't be possible, and would only have throat spray. The TNA then went back to the patient and communicated this, and then after the patient had the procedure, made sure the patient was okay and made sure that they were suitable for discharge. So it was the whole patient journey right from the beginning to the end that was undertaken by the TNA and was ensured an effective, safe patient care.
The TNA is an asset to the team because they're equipped with the knowledge and skills to be able to perform safe care. They're able to advocate for the patient, they're able to make decisions for the patient, safe decisions, because of the knowledge that they're equipped with and how they've been trained.
Definitely benefit patient quality of care and safety because of the extra knowledge that we have received from university, and by experience in different care settings, we can work better as part of a multidisciplinary level team, and we can, again, compared to healthcare assistants, become a bit more person-centred and holistic in the way we approach patient care.
It will greatly impact the patient quality of care because the delivery of care is very quick, is very prompt. And people who have a TNA course will definitely have knowledge, and they'll be able to liaise and they're able to refer to other multidisciplinary teams.
Being a trainee nursing associate, it really gives impact to within the healthcare team, because like for example, one of the best practice is like when the patient experiencing or deteriorating, like having increased respiratory rate, increased heart rate, increased temperature. As trainee nursing associate, upon initial assessment of the patient, you know already that the patient is having sepsis. So as trainee nursing associate, it gives help and it contributes within the nurses and within the other multidisciplinary team.
I work in district nursing within Whittington Health, so we find we have continuity of care for the patients. We have frail patients who they really value a familiar face, so once they have that continuity and somebody who has good knowledge and good skills, then it's quite good.